Good day everyone, this is Patsy, Mille, Plazo, and in this film I will explain exactly what an artifact is and how to identify artifacts in microscopy and differentiate artifacts from actual urine sediment. So what exactly is an artifact? The blood, kidney, lower genitourinary tract, and external contamination all contribute to form elements to the urine. This includes artifacts. In microscopy, an artifact is an apparent structural detail that is caused by the processing of the specimen and is thus not a legitimate feature of the specimen. Artifacts are often larger than the regular sediment elements and cause the microscopist to examine objects in the wrong plane. The urinary sediment artifacts include starch granules, oil droplets, air bubbles, pollen grains, hair and fibers, and fecal contamination artifacts and elements in urinalysis. So, how are we able to identify these things? To observe and identify these artifacts, they must be observed first under the light microscope since most of these can't be seen through our naked eye. The microscopic examination of the urinary sediment helps us to detect and to identify insoluble materials present in the urine, including the artifacts. Identification can sometimes be difficult even for experienced laboratory personnel. Identification can be enhanced through the use of sediment stains. Also, for us to identify them, we must be familiar about the features that these artifacts have. So the first artifact we have here is hair. Pubic hair and even hair can occasionally be found in the urine. Due to their large size, their identification under the microscope is easily confirmed by the microscopic examination of the specimen. Pollen grains are generally round to oval and some have a yellow-brown tint. They are most likely to be confused for parasitic ova. A good knowledge of the actual appearance of the few true parasite eggs that can occur in urine is easier to achieve than specific recognition of all types of pollen and mold spores. Again, optimizing specimen collection and handling will reduce the chances of seeing potentially confusing structures. Starch is the most common contaminant from the laboratory. It comes from the dusting powder used for the gloves worn by the lab personnel. It has a crystalline structure, a polygonal to roundish shape, and a nucleus-like center, often with a Y shape. Size can be very variable. Under polarized light, starch structures are birefringent and show the so-called pseudo-Maltese crosses, which is crosses similar to those due to lipids, but with arms of irregular length. The next one is air bubble. Air bubble are rather common, being due to the entrapment of air between the slide and the cover slip. The skillful microscopist of the urine should be able to reduce the formation of air bubbles by placing the cover slip on the slide with a gentle and aimed movement of the hands. Oil or fat droplets may appear as uniformly round refractile globules of various sizes under high-power bright field. Oil droplets from catheter lubricants may be confused with cells, especially red cells. Lipid materials from vaginal creams also forms droplets in urine. The next one is cloth fiber. Fibers from clothing and diapers may initially be mistaken for cast, though they are usually much longer and more refractile. Examination under polarized light can frequently differentiate between fibers and casts. Fibers often polarize, whereas casts, other than fatty casts, do not. In here, I made a summary about the aforementioned artifacts. So the first one is hair. It may initially be mistaken for cast, though they are usually much longer and more refractile. The next one is pollen grains, which are seasonal contaminants that appear as spheres with a cell wall and occasional concentric circles. Third one is starch granule contamination. This will occur when cornstarch is the powder used in powdered gloves. The next one is air bubble. which occurs when the specimen is placed under a cover slip. The next one is oil droplets. They are highly refractile when the fine adjustment is focused up and down. They may also appear in different plane than other sediment constituents. And the last one is cloth fiber. Fibers from clothing and diapers may initially be mistaken for casts, though they are usually much longer and more refractile. The next topic that I will be discussing is about comparison between actual sediment constituents and artifacts. Actual urine sediment consists of biological elements such as leukocytes, erythrocytes, epithelial cells, casts, bacteria, fungi, parasites, and sperm. On the other hand, artifacts consist of oil or fat droplets, air bubbles, starch granules, fibers, pollen grain, talcum powder, and hair. Urinary sediments have played an important role in the diagnosis and assessment of therapeutic effects, primarily in patients with urinary tract infections and other diseases of the kidney and urinary system, e.g. diabetic nephropathy or nephrotic syndrome. On the other hand, artifacts are substances observed under a microscope that are found in urine through accidental contamination. They are of no clinical interest. Some of the most common artifacts include glass debris, air bubbles, fabric fibers, and hair. The more widespread use of latex gloves, starch crystals, or talcum powder can also be found. Actual sediment constituents are elements in the urine that comes from the patient's body. Artifacts are elements in the urine that don't come from the patient's body. So, how are we able to differentiate between actual sediment constituents and artifacts? Maybe you too are confused about this. Many factors can influence the appearance of the urinary sediment, including cells and casts in various stages of development and degeneration, distortion of cells and crystals by the chemical content of the specimen, the presence of inclusions in cells and casts, and contamination by artifacts. Therefore, identification between the sediments and artifacts can sometimes be difficult even for experienced laboratory personnel. So we should always remember that artifacts are often larger than the regular sediment elements, and artifacts are often very highly refractile or occur in a different microscopic plane than the true sediment constituents. So we have here points to ponder. It is very important to notice artifacts or contaminants so that we will not be confused about artifacts from clinically significant substances. That's all for my video. Thank you for watching. Have a nice day.